You may have heard Medicare doesn't cover everything. You're responsible for deductibles and 20% of the costs unless you buy a MEDIGAP policy. While MEDIGAP does involve a premium, it can save you thousands of dollars. Since Medicare changes laws regularly, working with an agent to find a policy can save you time. Let's take a closer look at how MEDIGAP can lower your costs. When you visit a doctor or hospital, instead of paying deductibles and 20% coinsurances, your costs could be little to nothing. Some Medicare supplement plans cover you in a foreign country or give you more inpatient hospital days that Medicare wouldn't cover. With a MEDIGAP plan, you can see any doctor in the United States and have coverage. So if you develop a rare disease that few doctors specialize in, you can focus on getting care instead of trying to get out-of-network approval. Plus, you'll never worry about referrals. You can go directly to the specialist. Since MEDIGAP policies are standardized, the only difference between plans is cost. We understand finding the perfect policy alone can be a challenge. But finding a Medicare supplement is easy when you have the help of an expert. Our agents help people like you every day. We can give you quotes from all the top companies and make a recommendation based on your coverage needs. Then, after enrollment, our client care team continues to have your back.
Hi, I'm Angela James at the Centers for Medicare and Medicaid Services. Did you know that you can choose how you get your Medicare coverage? Today we're going to talk about the differences between Original Medicare, Medicare Advantage and prescription drug plans, and Medicare supplement insurance policies, which are also known as MEDIGAP policies. When you're eligible for Medicare, the first thing to consider is whether you want to get your coverage through Original Medicare or a Medicare Advantage plan like an HMO or a PPO. Both Original Medicare and Medicare Advantage plans have both Part A and Part B coverage. Part A covers inpatient hospital stays, care in a skilled nursing facility, hospice care, and some home health care. Part A is free for most people. Now, Part B covers certain doctor services, outpatient care, medical supplies, and preventive services. There's a monthly premium for Part B. Now, even though both Original Medicare and Medicare Advantage plans cover Part A and Part B services, there are some differences that I want to help you understand. Original Medicare is provided directly through Medicare, and you have your choice of doctors, hospitals, and other providers that accept Medicare. Original Medicare covers about 80% of your healthcare costs. Generally, you or any supplemental coverage that you have pays deductibles and coinsurance, and you usually pay a monthly Part B premium. Now, Medicare Advantage plans, also called Part C, provide coverage through private insurance companies that are approved by Medicare. In most plans, you need to use doctors, hospitals, and other providers that are in your plan's provider network. If you decide to use a provider outside of your plan's provider network, you may have to pay more or pay all of the costs. And there are usually co-payments or coinsurance for covered services, and you may pay a monthly premium in addition to your Part B premium. Now, each plan has different costs and rules, and some can have extra coverage like vision or dental. Now I want to tell you about Medicare prescription drug plans, also called Part D. These are plans that add drug coverage to Medicare. These plans are run by private insurance companies that are approved by Medicare. To add this coverage, you usually pay a monthly premium. If you have a Medicare Advantage plan that offers drug coverage, you may have to get that drug coverage through your Medicare Advantage plan. Otherwise, you can join a Medicare prescription drug plan. So do you remember how I told you that Medicare pays about 80% of your healthcare costs? Well, Medicare supplemental insurance policies, or MEDIGAP, is coverage that's offered through private companies to fill in the gaps in Original Medicare. With a MEDIGAP plan, you pay a monthly premium in addition to your Part B premium, and the cost for that premium can vary between policies and companies. You may also be able to get similar coverage through an employer or a union. It's important that you realize MEDIGAP policies don't work with Medicare Advantage plans. In fact, if you already have a Medicare Advantage plan, it's illegal for someone to sell you a MEDIGAP policy. Now, these are just the basics. To get more information about your Medicare choices, visit Medicare.gov, and you can also check out some of our other videos on this YouTube channel to learn more. Hi, I'm Angela James at the Centers for Medicare and Medicaid Services, and I'd like to tell you about the different parts of Medicare. Medicare is health insurance for people age 65 or older, people under 65 with certain disabilities, and people of any age with ESRD or end-stage renal disease, which is permanent kidney failure that requires dialysis or a kidney transplant. There are 4 parts of Medicare: Medicare Part A, B, C, and D. Medicare Part A, or hospital insurance, helps cover things like inpatient care in hospitals, skilled nursing facility care, hospice care, and home health care. Medicare Part B, or medical insurance, helps cover things like services that you get from doctors or other healthcare providers, outpatient care, home health care, durable medical equipment, and some preventive services. Medicare Part C, or Medicare Advantage, is another way that you could get your Medicare coverage. Now, here's what you need to know about Medicare Advantage plans. They're run by Medicare-approved private insurance companies. They include all the benefits and services covered under Part A and Part B. They sometimes cover extra benefits and services for an extra cost, and they usually include Medicare prescription drug coverage, which is called Part D. Now, speaking of Medicare Part D, let's take a look at some of the basics. Part D plans help cover the cost of prescription drugs. And like Medicare Advantage plans, they're run by Medicare-approved private insurance companies. If you don't join a Part D plan when you're first eligible, and you don't have other creditable prescription drug coverage, you may pay a late enrollment penalty if you choose to join later. Creditable drug coverage is prescription drug coverage, like from an employer or a union, that's expected to pay on average at least as much as Medicare's standard prescription drug coverage. With Medicare, you get to choose how you get your coverage. You can choose Original Medicare, which includes Part A and Part B coverage. And if you want prescription drug coverage, you must join a separate Part D plan, or you can choose to join a Medicare Advantage plan, where you'll get your Part A and Part B coverage from the Medicare Advantage plan, not Original Medicare. The Medicare Advantage plan may include Medicare prescription drug coverage. Now, this is just basic information about your Medicare options. You'll need more detailed information to make an informed choice. And before you make any decisions, learn as much as you can about the types of coverage available to you. To learn more, visit Medicare.gov.
We can give you quotes from all the top companies and make a recommendation based on your coverage needs.